The DFL candidates for governor are calling for a single-payer healthcare system in Minnesota to address the health insurance mess we have right now. And it sounds great, right? Everyone is covered and you don't have to pay for your health insurance anymore. It sounds too good to be true because it is. In fact, single-payer would be an absolute disaster for most Minnesotans. Let's be clear about what single-payer really means. Private insurance is gone. Every single Minnesotan with some form of private insurance, whether through your employer or otherwise, will lose your plan and will be forced onto the single government plan that exists for everyone. The system will be designed and run by state bureaucrats who will decide what the health plan looks like and what treatment is granted or denied. And treatment will be denied. Single-payer systems control costs primarily by limiting access to health care, either by forcing patients to wait indefinitely for treatment or by just denying treatment outright because the procedure is too expensive or the patient is too old or sick. The best example in America we have of single-payer health care is the VA. Yes, that VA, the one responsible for veterans dying as they wait indefinitely for treatment. That's single-payer health care. We also have examples from other countries. Great Britain and Canada come up the most often. Their experience with long wait times and rationing is not encouraging. And on top of all this, the cost to taxpayers is crippling. Vermont, California, Colorado have all recently abandoned plans to implement single-payer based on the cost. They found that the new system would nearly double their state's budgets and require a new 10 to 11% payroll tax on every employee in the state. So here's the single-payer bargain. You will lose your health insurance and be enrolled in the government plan that everyone gets. You'll probably lose your doctor, you'll probably see longer wait times, maybe much longer wait times, and you'll quite possibly be denied treatment that government considers too expensive. Oh, and your taxes will skyrocket. I don't like that bargain because we need to be moving in exactly the opposite direction to fix health care in Minnesota. As governor, I'll work with neighboring states to allow Minnesotans to buy insurance across state lines, eliminate state mandates that limit consumer choices, and empower individuals to buy limited coverage policies at a lower cost if they choose. We'll revive Minnesota's high-risk pool, providing coverage for those with pre-existing conditions, and will allow people on subsidized programs to take that subsidy money if they choose and spend it in the market for something that better suits their needs. I don't make promises lightly, but I can promise you this. When I'm governor, Minnesota will never have a single-payer system. Instead, we'll take care of those in need, as Minnesotans always do, and we'll give individuals more choices and more control over their own health insurance and their own health care.